Distancing is crucial. That's the big takeaway tonight from UW researchers who were tracking the trajectory of COVID-19 around the country and here in our state.
We have team coverage tonight. KOMO's Keith Eldridge and Patrick Quinn are standing by, and we begin with KOMO's Michelle Esteban with more on what the latest models from the UW mean for the state. Michelle?
Well, hi there, Eric and Molly. Here's what I can tell you. The new data is significant. And when we're talking about projected total deaths in our state due to COVID-19, we are seeing a significant drop, and that is all about social distancing, keeping those kids home from school, those essential workers staying home. In short, it is keeping the course.
The early returns suggested that social distancing has already been working. For example, King County here in Washington.
Dr. Chris Murray says that's based on what's happening inside our hospitals, particularly in King and Snohomish counties. The need for hospital beds, ICU beds, and ventilators has declined significantly. In other words, we've been able to meet the need. That's why on Sunday we learned Governor INSLEE was sending 400 ventilators back to the federal stockpile.
Our needs estimates are down because we have more clinical practice data.
The new UW modeling factors in new data points that include reports from hospitals, statewide death stats, even mobility data. The new data impacts projected deaths in our state too, peaking possibly as early as May 10th.
We expect a peak sooner rather than later.
This new modeling by the UW researchers is really encouraging because it cuts the total projected deaths from COVID-19 in our state down by more than 60% to 632, all the way up from 1,600. And what it speaks to is all the social distancing. But it also says we've got to continue the social distancing until the end of May. So right now, the projected deaths sit at 632, but we have to also look at the range here and take a look. That's what the shaded area is here. 557 for the low and the expected high, 741. It could fall anywhere in there, but the best science right now tells these researchers 632 if we keep up with all the social distancing. Whether our state decides to extend the stay-at-home order longer than May 4th is up to the governor.
Their forecasts will get progressively worse day by day if they don't put those orders in place.
It is so important that we continue these challenging practices like staying home and practicing that social distancing, because as fast as that curve can slightly be flattened, it can also get worse. On this beautiful spring day, it's quiet at Alki Beach, an illustration that many are using physical distance to fight COVID-19.
I think this is a time for people really to remain vigilant about that physical distancing and allow time for the virus to really wane in this part of the country.
Today, good news so many have been waiting for. Modeling that indicates we've started to slightly flatten the curve in Washington. But that doesn't mean softening our new practices.
If we stop doing our physical distancing and the other measures that we've been doing, there's a chance that this could come roaring back.
Traffic data from the state and city shows volumes have continued to decline between 40 and 60% through March and into April. More proof people are doing the right thing and staying home.
Just because we've potentially passed the peak or at the peak does not mean that there are no more cases.
It's important to know community transmission is still happening and more cases will continue to emerge. As the holidays approach, experts say physical distancing is more critical now than ever before.
I think it would be good to have a national stay-at-home order, and the reason is that even if Washington gets on top of this fully, if another state doesn't, it can come back and come across our borders 2 months from now.
Swedish Hospital's Dr. Elizabeth Meade says she'd like to see a federal strategy so we could all better understand restrictions from state to state with a coordinated plan on how to eventually ease restrictions when that day eventually comes.
I think this is actually the critical moment for us to not relax. I think this is the time when we have to really see this through.
Schools statewide will stay closed through the end of the school year as cases of coronavirus continue to climb.
Let's get right to the latest totals. Based on a tally from the state health department and individual counties, nearly 8,000 people have tested positive. At least 381 people have died from the illness. That's nearly 100 more than this time on Friday.
We start our team coverage tonight with KOMO's Keith Eldridge and the decision to keep kids out of the classroom for the rest of the school year. It's a decision with huge ramifications.
Definitely out of the classroom classroom, but not out of the thick of learning. It means families are going to continue to be the core of education. Now, we recently visited with the Smith family right here in Buckley in the White River School District. They're just now getting word that their home classroom setup is going to have to be the norm for the rest of the school year. The governor and state superintendent say it is just too difficult to maintain social distancing in schools. It's just too important to keep making the progress that's showing up in the numbers of cases that appear to be going in the right direction. But it means more than 2 more months of classes in the kitchen.
And this school closure is part and parcel of those efforts, not only to flatten the curve as it goes up, but to reduce the number of deaths that occur as it goes down. We cannot risk losing the gains we have made after the peak of this pandemic presumably will have passed.
You know, we love the kids' teachers, and you know, it's always exciting towards the end of the year to have all those fun activities, but I also think it's probably for the best because we're still not out of the woods yet with the pandemic, and so it's probably for the best to keep the kids out of school the rest of the year so that this virus can go away.
And State Superintendent Chris Rakedahl says there is no guarantee that schools will be able to reopen in the fall. It all depends on how well people continue the Stay Home, Stay Healthy initiative. And it is important to note that seniors will graduate, grades will not be affected. Live at home, Keith Eldridge, KOMO News.
What can you do to help support students and teenagers? KOMO's Tammy MUTASA is live in the newsroom with the answer from the experts. Tammy?
Mary, you know, this is unprecedented for parents, teenagers, and young people. Experts say they will need support more than ever before because schools closing for the rest of the year means a huge loss.
This is really a pretty significant time of loss for these students.
Since the COVID-19 outbreak forced students to stay home, Dr. Amy Mazulis, the chair of Seattle Pacific University's Clinical Psychology Department, says this new study shows teenagers and young adults are reporting more depression and loneliness. Now that schools are closed for the rest of the school year, it's a loss for many activities.
Graduation. I have a high school senior. She's not going to get graduation this year, right? And so what we're going to see in addition to just loneliness and anxiety is grief. It's really lost. These are hopes and dreams that people wait years to celebrate that they're not going to have the opportunity to celebrate.
Dr. Mazzula says these strategies will help teenagers manage their mental health during this challenging time. Set a schedule, get normal sleep, be the good, like finding ways to be helpful, socially engage, use your body, use your mind, manage anxiety, and try to see a silver lining.
The solution is not easy. One thing I think about a lot as a clinician and a parent is really acknowledging and owning how stressful and difficult this is. So my very first piece of advice to parents and friends, clinicians, when talking with their teenagers is to ask their child, what is it about this that is hardest on you?
Dr. Amy says if you need to figure out how to talk to a therapist, even online, you can call the Washington State Mental Health Referral Line. We will also link a website with a lot of resources at KOMOnews.com.